Hello, everybody. Hi, Project NICU community. We hope that you're having a wonderful Monday, and we're pretty excited over here at Project NICU because this is the very first day of our fifth annual NICU Mental Health Week. Yeah, and we're really excited. This was something that our organization was honored truly to start 5 years ago as a way to sort of add to the conversation and provide a space where we can share information, resources, and just general awareness and support for all of those within the NICU space regarding their mental health. This is such an incredibly complicated experience. And so we hope that this week is one where you will feel supported, validated, gain some really great information and insight. And all the things. So, we really wanted to focus this year on the idea of connection and how important that is for anybody going through obviously mental health challenges, but especially for parents like us, those who experience the NICU firsthand. It is so isolating, right, Morgan? It is isolating. You feel like nobody else can possibly understand. Not to mention, obviously, the emotional isolation, but the literal physical isolation too that we
Mhm.
experience. So we thought that there would be no better way than to welcome our dear friend Morgan Kowalski from the Family Centered Care Task Force to help us kick off the week and the conversation. We are absolutely honored to have her here with us, and we are also honored as Project NICU to be part of the FCC task force, which is dedicated to quality improvement in NICU family centered care. Morgan, who's joining us today, is the proud NICU parent of Thomas, born at 25 and 1 in 2018. And Morgan now serves as the program manager of the Family Centered Care Task Force out of Sanford, which exists to support NICUs as they begin to or simply strengthen their family centered care practices within their units across the country. Morgan is an active member of the American Academy of Pediatrics Family Partnership Network and Quality Improvement Family Partner for Golisano Children's Hospital NICU in Rochester, New York.
Mhm.
Morgan, thank you so much for agreeing to spend some time with us and to help kick off this week talking about family centered care, what it is, and how it relates to mental health of our NICU parents.
Thank you so much for having me,
Yeah.
Rochelle. And thank you so much to Project NICU for being an organizational partner of the Family Centered Care Task Force. We really rely on you guys to help us get the word out about the projects that we're doing, the free education that we're providing, the free resources that we're providing. And so we just are so grateful for you all. I do want to just share what family centered care means.
Yeah.
Just for those of us who are not familiar or who might need a refresher, family centered care is all about partnership between healthcare providers and families. It's about respect. So, respecting a family's unique needs, preferences, values, beliefs, cultural background, individualized care. So, tailoring care to the specific needs and preferences of each family, relying on families as a source of expertise and support for their baby, open and honest communication, and then empowerment. So empowering families to participate in the decision-making process and advocate for their child. So this is a philosophy that's like very quickly becoming the standard, right, of care in NICUs. And, it's been clinically proven that when families are involved in the care of their infant, their health outcomes are better. Family well-being and mental health outcomes are better. Mortality rates are lower. Readmission rates are reduced. Length of stay is reduced. So there's a whole host of reasons why this needs to be at the forefront of the care that we're providing in the NICU.
Mhm. It's wonderful. Morgan, one of the things that, and it can sound a little cheesy, I think, at times, but one of the things that we always like to remind parents, especially those who are currently in the NICU right now, is just this idea that, listen, in an unforeseen situation such as the NICU, where it feels very difficult to even be allowed or welcome to really step into that parental role and see yourself for what you are, which is the most important member of your baby's care team. So family
Absolutely.
centered care is so precious to us, right? Because those of us who advocate for it and who learn about it, because it really helps to support families being that integral person, the most important member of a baby's care team. Their voice is important, their insights are important. Um, yeah. So, can you talk to us a little bit about how family centered care directly impacts mental health of NICU families?
Absolutely. I think a big piece of it is that when parents are empowered, family caregivers, anybody, they're caring for the infant as a family member, is empowered to be present and empowered to participate. It's confidence building.
Yeah.
It nurtures bonds. When you're encouraged to be at the bedside and participate in hands-on care, whether it's bathing your infant, changing your infant's diaper, maybe you're starting to learn more about your infant's trach care, or the nasal cannula or NG tube or G tube that they're going to be going home with. That's all necessary for improving caregiver confidence, because as we both know, you show up in the NICU, you're completely unprepared for what's
Yeah.
happening. You're surrounded by medical professionals who have been training their whole careers for this, right? And you're kind of the left out of the loop, essentially.
Mhm.
You're kind of the only person in that situation who doesn't know what's going on.
Yeah.
And so that can be incredibly isolating, to your point. And like, I guess I'm not really needed here. Like, I think a lot of families struggle with the guilt and the shame of like, I already failed my baby by either not carrying them to term, or, you know, some sort of diagnosis that happened along, the pregnancy, or maybe the baby's born with complications. And I think a lot of families blame themselves,
Right.
which is a totally normal and valid experience to have. And I think then not only are you, processing that, but you're not the expert on your baby once
Mhm.
he or she is born. And so that can be really difficult. And I think family-centered care is about empowering families to really like connect with and be the expert on their infant's care. And as you and I both know, Rochelle, like the NICU is just the prologue. You
Yeah.
you go home, you're seeing specialists, you're doing therapies, you're a lot of the times, advocating for special education in the education system.
Mhm.
And we need to have those advocacy skills built early on in the NICU so that we can feel empowered to do that later on in our children's lives. I
Yeah.
think the whole family well-being is affected by that, right? And so when that's lacking, I mean, it's just a recipe for disaster in terms of health and mental health for infant and parents.
Mhm. I remember, when our little guy, so he just celebrated his ninth birthday yesterday,
Oh,
so I
happy
am almost
birthday. Oh
thanks.
gosh.
So, it's crazy even thinking back, almost a decade removed from my NICU experience. Like, that is
Mhm.
wild to say, but it's funny the things that kinda stick with you. The instances, so we were very fortunate to very much be in a unit that practiced active family-centered care much before, we had the family-centered care task force, or before a lot of the
Mhm.
work was really being done and talked about, which is great to see the change and the movement in the time since. But even back then, I remember on those days where I just did not feel like a mom. I didn't feel like I could show up for my child the way that I had always dreamed of, right? And
Mhm.
so I remember the first day that, a nurse really encouraged me to help out with our baby's care. He had a lot of complexities and gut related stuff. And so, we had an ostomy that needed changed, and all that kind of stuff. And so the first day that I got my hands on all of that and was very actively involved and thought, I can provide care to my baby here in this place.
Mhm.
I'm not a hands off visitor watching this occur. I can be very much involved and have a voice
Mhm.
and learn about my baby's care and condition. And um, one of the things that we encourage parents to do a lot is something that certainly we've learned from, the task force with you is, making sure that you can be present for rounds, and that the hospital meets your need in that regard, right?
Mhm.
If parent or caregiver can't be there for the 9 a.m. rounds, maybe we need to round on that parent last in the unit because we know that
Absolutely.
they'll be coming in later. So
Absolutely.
yeah, and I think how can hospitals learn more about family-centered care? That's something we want to make sure that you really touch on. How can they learn more about it and take it back to their leadership, if it's something that they're not already looking at and learning about?
Yeah, that's a great question. And I would strongly encourage anybody who's seeking more information about family centered care to join the FCC task force. Our website is fcctaskforce.org. Membership is free. All of the educational webinars, office hours, resources that we provide are all free because we really just want this information out there. Right now, there's really no like standard of care for family-centered care. There are some guidelines that are in place by the American Academy of Pediatrics according to like the level of care that your NICU is designated. But it really should be standard across the board. What is expected if you're going to be saying that your hospital is practicing family-centered care? And so something that our organization has been working on over the last almost 24 months is creating the first ever metrics for family-centered care in the NICU. So holding institutions to a very specific set of practices so that they can know for certain whether or not they're truly delivering family-centered care in the NICU.
Yeah.
So what I love about the FCC task force is like everything's equal representation in terms of like family partners and healthcare providers and researchers. Everything from our core leadership team to our committees, any projects that we're working on, everything has completely equal representation between healthcare partners and family partners, which I think is so important when you're working on anything quality improvement related in the NICU, because if you're not involving families at the inception, creation, in the research process, I mean, you're just guessing about families' needs, right? And so we created this very comprehensive questionnaire that we're currently piloting right now. We've got 87 NICUs who have participated already, who are interested in learning, where their strengths and weaknesses lie in practicing family-centered care. And then we're going to use that data to really create the first ever metrics for family-centered care. So we've got 7 categories, and I really invite any NICU, whether you're, just beginning your family-centered care journey or you feel like you're a rock star, we invite everybody to participate because it's a great jumping off point. If anything, it's an awesome conversation to have with your team, right? Just filling out the survey with your team, I think is really beneficial. And it just kind of opens the door for some of these conversations and like, hey, we don't do that here. How could we do that here? So we've got, a few different categories that we've created in partnership between families and healthcare providers. We've got NICU framework and infrastructure. And some of the questions that are mental health related under that category are like, does your unit have an on-staff psychologist and or a mental health counselor? And that could be for families and for staff. Does your unit provide referrals and resources to families for mental health support outside of the unit? If not, and what does that look like? Are you just providing the information? Are you creating a referral and then making an introduction? What level of support are you giving families and guiding them to these resources? And then does your NICU have a dedicated clinician that's there to help screen families? We have a family support category that talks about like peer support programs. Do you have a peer support program in your NICU? Is your peer support program consisting of diverse family voices? Do you have, if your NICU doesn't have a robust peer support program, are you relying on national peer support programs in the United States? And then again, like, how are you connecting parents to these organizations? Are you just saying like, hey, go check out Project NICU? Or are you saying, hey, Morgan, I'm going to give you Rochelle's email I'm going to make a warm introduction so that you guys can get started on what your specific needs are. We have a family integration into care category that talks about, how are you including parents in the care of their infant? We have a family integration into QI and processes category. So how are you engaging families after discharge to understand where your strengths and weaknesses lie and, how things can be improved and including their story and their perspective. We have a staff education category. So are you educating staff on trauma-informed care, communication, family-centered care? And what does that look like? Is it mandatory? Is it optional? Is it paid time? Is it unpaid time? And then we've got some balancing measures. So it's very apparent that caring for families, their needs, their mental health, is very, very prevalent in providing family-centered care, because if families are unwell, how can
Right.
they be there for their infants?
Mhm. Yeah, we one of my like favorite, again, a little cheesy, but one of my favorite quotes, and I have it hanging up on my desk as we speak, was from our son's surgeon from way back when we were in the NICU, and he reminded me that when a baby is sick, a mother is much sicker. And so,
Love that.
by looking at the family unit, whatever that looks like, whatever the caregiver
Mhm.
dynamic looks like, and baby, we really need to treat them together as one unit, one dyad, because it is, yeah, they just play off of each other. The outcomes, right? The research is loud and clear that the better supported parents are through these measures, family centered care specific measures, right? They're better able to make decisions, medical decisions, which,
Mhm.
I mean, Maureen, just like I do firsthand, how gut wrenching that is. The responsibility of really hoping that you can trust these providers and that they are hearing
Mhm.
you and you're asking the right questions and you are making the right choice for your baby. That burden is absolutely overwhelming for parents who find themselves in this, position of learning about organs that they didn't know existed and whole body systems and everything else that can happen to a human body, right? So being
Absolutely.
able to feel like you are adequately educated and being taught about your baby's condition, the freedom to ask questions without judgment, being able to be present in the room when all of those sidebar conversations sometimes happen, where historically providers, would leave your baby's bedside and step into the hall and have conversations
Yeah.
that you probably weren't part of. So something
Mhm.
as simple as having those conversations bedside, inclusive of parent. And I even think about, we've had parents, comment that their hospitals, the visitors badges that they wear, how they say visitor, and they have to wear that badge when they walk in to meet their baby. Whereas,
Yep.
for example, the hospital that I was at, it's a big giant P for parent.
Love.
And still got to sign in, still have to show your ID, still have to wear a dang, you shouldn't have to do any of these things, right? Your baby should be in your arms on the couch at home.
Right.
But something about just being acknowledged with a badge as a parent versus a visitor.
Mhm.
Those are all these tiny little steps that units can make, right? To ultimately practice true family centered care. And there's lots of other things too. But the survey that you mentioned, where
Yes,
your unit can go on and sort of see where you rank or score, right? Within the unit,
absolutely.
we are sharing that in the toolkit that everybody who registered for this week
Awesome.
will get. So you can go on, and Morgan would love to have your data,
Yes,
right?
and so the benefit of completing the survey is that, it's comprehensive. So you really do need to engage with multiple team members in order to complete it to its fullest. But once you complete it, you get your unit score, or you get a score in each category immediately after completion. And then you have the opportunity to do an interview with our research team, which consists of myself, me and Malcolm, our founder, Malathi Balasundaram, and a few others on our research team. And that's where you can learn, more about how to overcome in some of the areas where maybe you scored a little bit lower. And then also see where your unit compares to other units across the nation in
Yeah.
performing family centered care. And then once the interview process is completed, we're going to start creating opportunities for like kind of more small group quality improvement work that's more topic specific. So
Mhm.
let's say one NICU really wants to create a family centered care committee. Okay, well, how are we going to do that? What does that look like in your unit? What specific barriers are you facing in accomplishing that? And, where have other NICUs found success in overcoming those exact same barriers? So
Mhm.
it's like, it's just I don't know, it just feels so, like, just let us do the heavy lifting for you,
Yeah.
like,
Yeah.
it just, the hard part is filling out the survey, and then let us help you with the
Right.
rest. Let's
Right.
not reinvent the wheel. It just feels like such important work, I guess is what I was gonna say,
Mhm.
at least from where I'm standing, because just the dedication that I see from these units, even those who might be underperforming to a degree, their interest in doing this work is what makes their unit special and what makes their culture special
Right.
in their unit, right? And so it's just been really cool to see as we've kind of gone along just how passionate people are about caring for families. Because we know that's kind of the first thing to get forgotten, right? Like babies in critical care, kind of the last thing we're worried about is like how mom and dad are coping or how mom and mom are coping or what, whatever that looks like
Mhm.
in the family dynamic. So, um, yeah, I highly, recommend taking the survey. We are closing it July 31st. That's the deadline to submit. We did already close the survey in February, but so many folks have expressed an interest in having us reopen it that we did
Good.
do that.
Good.
We do have a very hard stop on July 31st because we need to have our interview process completed by the end of this year
Mhm.
so that we can move forward on to the next thing. So if you have any questions about that, I'm hoping that, my contact information is shared in the toolkit. If it's not, we can
Yep.
certainly put that on blast. So
Yeah, yeah, and I think too, something as simple for all of you out there, I always learn a lot of things and I'm reminded of things with FCC Task Force simply because of the newsletter, and Morgan sends those out, I mean, pretty darn consistently, and they're always filled with a ton of really, really good information. So, even if you are a parent currently in the NICU, there might be things there that are helpful to you too. At least I think so from our perspective as an organization. Um, Kind of in closing, Morgan, I want to ask very specifically, if for friends or family members of a parent who's in the NICU right now, or a parent who's listening right now, or a nurse, um, if a parent is in the NICU as we speak
Mhm.
today, and they are feeling, all the things, right? They're feeling a total lack of control. They don't know or have faith, that they are being heard, that their concerns are being heard. They feel like they are not a parent. They're really struggling every day bedside with baby. What are some tips from your perspective, Morgan? What can a parent maybe be doing and or asking for that you think might be beneficial to them in their mental health while they're
Yeah.
still in the NICU?
Yeah. Well, first things first, if you're a parent listening to this and you're in the NICU or you came home from the NICU recently, I validate you. And you are allowed to feel gratitude that your infant is alive and grief that your family is in the NICU.
Yeah.
And you're allowed to feel the duality of positive emotions and negative emotions, and I validate you. Um, you're feeling the all of the right things, no matter what those feelings are, because this is an impossible situation and there's no right and wrong when it comes to the NICU. A couple of tips from me personally would be first and foremost, you need to care for yourself exactly how you would care for your infant. You would not deny your infant meals. You would not deny your infant rest. You would not deny your infant comfort. So you need to take care of those things for yourself. It's okay to leave the bedside to do those things. And first and foremost, you need to, look out for yourself because if you're, especially if you're a breastfeeding mom or you're pumping, um, your baby's going to be getting, the feel good hormones from that breast milk if you're taking really, really great care of yourself. So do your best. I know it's hard, but try to get some rest. Try to eat regularly, um, and ask for help and accept help. I know that folks are always like, hey, let me know if there's anything I can do. I want your response to be actually, yes, I need dinner tomorrow night.
Mhm.
And can you do that for me? And
Mhm.
here's where I need you to drop it off. And so go ahead and take advantage of the people who want to help you because um, they want to, or they wouldn't have offered.
Yeah.
And my second tip would just be um, just to really do whatever you can to educate yourself on your infant's diagnosis. Ask questions, even if you haven't been invited to ask questions by the medical team or you haven't been invited to know more about your infant or participate in care. I'm giving you permission to ask those questions,
Mhm.
ask for the resources where you should be looking into things. Ask how you can participate, ask when rounds are happening so that you can be there. I'm giving you the permission to do that if nobody has yet. Those are really important. And that's the best way that you can take care of your baby right now. So, taking care of yourself and making sure that you are as present as possible and can know as much as you can about your baby.
Yeah. Well said. Oh, Morgan, thank you so much. We appreciate you. We are absolutely honored to be able to kind of, just walk alongside all of the amazing work the task force is doing. You know
Ditto.
how important that advocation is, for our parents. Um, yeah, great. Thank you. Thank you for your
Thank you,
time.
Michelle. Oh my
Yay!
goodness.
And for everybody listening in, whether it's now or in a little bit, after you've got your coffee and you can listen to this later recorded, we hope that you join us for the rest of the week. We're going to be
Yeah.
sharing lots of information, survivor stories, statistics, just really tangible stuff that you can take back to your hospitals or for your own personal benefit if you're a parent or professional. Tonight, we actually have, kind of in keeping in mind with the idea of connection and the NICU ecosystem, right? Not just the parents, but the grandparents and
Mm,
siblings and friends and family of NICU families. Tonight is our NICU grandparents virtual support group meeting, which is at
oh my
7 p.m. Eastern. It is just one of our most prized possessions here at Project NICU. We love that opportunity for the grandparents to get together and to just casually talk about all the things and support one
gosh.
another as they also go through this together. So,
Mhm.
Morgan, thank you so much. Again, we appreciate you. Take
Thank
good
you,
care,
Rochelle. Thank
and
you,
we'll be
Project
sharing
NICU. We love
yay!
you.
We'll be sharing all the information.
Thank you.
Thanks, everybody.
Bye.